Nellie Setra's parents moved to America from Ghana to pursue the American dream. They worked hourly wage jobs to support their two kids and ultimately became licensed practical nurses. But they never had much money.
My dad's credit score was to the point where it was just awful. He had to file bankruptcy because he was in so much debt.
Still, their children had big dreams and they understood the value of hard work. Setra, who currently works as a nurse with a local health department, is now a student at the University of Virginia, pursuing her doctorate to become a family nurse practitioner and to teach others who want to be nurses.
I do plan to work in underserved communities and rural regions because that's something I'm used to. And I feel like that's where my expertise are needed the most.
She is able to pursue the doctorate because she qualifies for $200,000 in federal graduate degree loans. Would you be able to pursue getting your doctorate as a family nurse practitioner if if you couldn't get these loans?
I would not. I cannot afford it. I just physically cannot afford it.
But future nursing graduate students like her may not be able to access as much federal loan money under graduate loan program changes within the One Big Beautiful Bill. Those changes would mean students enrolling in post-baccalaureate nursing programs would be eligible for half the amount of money in federal graduate loans they are currently allowed to take out. Currently, they can take out $200,000 in federal graduate loans. That number would drop to $100,000 if the changes take effect.
This impacts those that are pursuing a master's in nursing, a doctorate of nursing practice, or a PhD in nursing. And so those graduate programs actually prepare nurses to be advanced practice nurses, whether that is nurse practitioners in primary care, midwives, specialists, and also as educators and nurse scientists.
On its website, the Department of Education states 95% of nursing students borrow below the annual loan limit and are therefore not affected by the new caps. Further, placing a cap on loans will push the remaining graduate nursing programs to reduce costs, ensuring that nurses will not be saddled with unmanageable student loan debt. Cindy Rubenstein, director of nursing and professor at Randolph-Macon College, says she understands the administration's desire to control tuition costs and limit borrowing amounts. But she says the reality is that the proposal does not take into account the cost of key professional programs that we have shortages in.
Healthcare training at the graduate level is more expensive than other training programs and other graduate degrees. And that is because of the requirements for clinical practice.
Both Rubenstein and Setra worry that reducing the amount of federal loan money a person can take out to pursue those higher nursing degrees will stop people from entering the programs because they either don't qualify for a private loan or the interest rate is too high.
I likely foresee in the future that graduate students are going to get themselves into private loan debt. And with these programs, there's no student forgiveness, there's no leniency, there's no income-driven plans for you to be able to pay that back.
The federal loan changes are expected to take effect on July 1st of next year. The United States Department of Education says it may still make changes to them based on public comments. In Richmond, I'm Melissa Hippolyte for CBS 6.